going to discuss how to use an occupation focus when we're addressing reflex integration. So let's start off with the assessment process in occupational therapy. That's our first step of the occupational therapy process, is to assess. So what does that look like in reflex integration? Well, the presence of reflexive patterns may indicate difficulties in sensory processing. Before, I discussed a little bit about proximal outcomes and distal outcomes, and assessing reflex integration is part of our proximal outcome measures. Reflexes should be considered in the context of our occupations. How do they influence what goals the child has? What areas of performance that they may be having trouble with? And are they a barrier to those areas or a facilitator? We always want to make sure that we're taking that proximal outcome measure and linking it to our distal outcome measures. So if I think of reflex integration in the assessment process as part of the data gathering process to formulate my hypothesis on sensory processing, which we'll talk more specifically about in section 2 on assessment, I need to be able to link these areas of difficulty to what the distal outcomes, which would become my treatment plan, my goals, and these should be very patient-centered and client-oriented. The presence of primitive reflexes may not equate functional difficulties, so just because I see a poorly integrated reflex, if I'm not having any functional difficulties, there's no reason to address that reflex in an intervention process.